It's been revealed nearly 1 in 4 patients is being forced to wait on ambulance stretchers for more than half an hour at the state's public hospitals. The health department claims care isn't being compromised, though some suggest ramping figures can't be trusted.
Inside this ambulance communication centre, bursting parking bays seemingly aren't an unfamiliar sight.
We do have surges in the number of patients that present to the emergency department. 7
News released photos of this surge at the PA late last year, showing patients crammed into corridors.
There is always clinical handover and information provided, and patients are absolutely not dumped in hallways.
The amount of people waiting more than half an hour on stretchers is most common at the Redlands, Logan, QE2, Princess Alexandra, Royal Brisbane and Women's, Robina and Gold Coast University hospitals. But critics argue the numbers are even worse.
The statistics are being artificially manipulated through this abuse of the rapid offload procedure,
which sees patients out of ambulances more quickly, but potentially parked in hallways.
Whether the data improves or not, the net result is that an ambulance is freed up.
Statewide statistics remain unflattering, with 1 in 4 patients suffering an imminently life-threatening condition forced to wait longer than the recommended 10 minutes. One reason given, 4% more patients.
And that's quite significant given that population growth in Queensland is around 1.8%.
I don't think it's right for the government to blame patients.
Queensland health workers have hit back at claims patients are being dumped in hospital hallways in a bid to lower ramping statistics. Some nurses argue the practice is putting lives at risk, but others believe the claims are more about politics.
They're the shocking photographs leaked by a whistleblower that are meant to show just how bad overcrowding has become in our public hospitals.
The Minister has made an edict to reduce the maximum waiting time for ambulances, and this has led to patients being dumped in hallways unattended.
But while a picture may tell 1,000 words, what this one doesn't say was that it was also leaked by the opposition 4 months ago.
What it is the LNP keeping this government and this minister accountable. There has been bungle after bungle after bungle.
In October, bed shortages saw ramping reach 24% statewide, which means about 1 in 4 patients weren't transferred from a stretcher within 30 minutes of arrival.
So there is always clinical handover and information provided, and patients are absolutely not dumped in hallways.
There have been modest improvements in treatment times in the southeast, but critics claim the figures have been skewed by moving the problem from the car park to the corridor.
The number of people who are managed through this process is less than 1% of the number of patients who are transported by ambulance to the hospital.
Minister Stephen Miles argues the practice helps get ambulances back on the road quicker. But despite the association's criticism of the minister, it doesn't think the LNP would necessarily do any better.
I'm yet to see a politician political interference make things better.
Tegan George for 10 News First.